Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. We are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. Breast augmentation continues to be one of the most popular cosmetic surgeries performed in the U.S. We have joining us Dr. Todd Rao, a renowned board-certified plastic and general surgeon from Redlands, California. Dr. Rao completed his general surgery residency at St. Agnes and Johns Hopkins Hospitals and his plastic surgery residency at Pennsylvania State University Hershey Medical Center. Dr. Rao has received multiple awards recognized for his clinical and patient relationship skills. Hey, I'm Amy, and we are live in the studio today with Dr. Rao, who's going to tell us a little bit about breast augmentation. How are you today?
I'm doing great, thank you.
All right, so let's get into some questions here about breast augmentation. And first and foremost, what is breast augmentation surgery?
Breast augmentation surgery involves utilizing breast implants and placing those underneath the breast to enhance the breasts in all dimensions. So the patient would expect fuller breasts and be able to wear larger bras and different clothing that they haven't been able to wear, helping with their self-confidence.
Okay. Who would be an ideal candidate for this, or a good candidate?
Well, certainly with all surgeries, a good candidate is somebody that's healthy, both mentally and physically, and somebody that suits the role, which would be smaller to moderate-sized breast individuals. Certainly women, however, we have, there's a male population of the transgender that also is taking off too. And we have some larger-breasted women that are requiring breast lifts and they want more upper breast fullness, so that would be another candidate to put an implant in to create and redesign that breast to the way they want.
Okay. Who might not be the best candidate for this?
Smokers, poorly controlled diabetics, patients that aren't mentally or physically ready for it, whether it may be their heart or other issues.
Okay.
And somebody that already has very large breasts, and it wouldn't be a reasonable candidate. And the list could go on with people with very thin skin and other scenarios.
Okay. All right. What should a patient look for when they're seeking out their plastic surgeon?
Certainly you want to look for somebody that's board certified by the American Board of Plastic Surgery. You want somebody that's been in practice, preferably for a number of years, so they have the skill level and the knowledge to treat a variety of patients and possible, if it happens, complications. That would be the number one factors I would look at.
Okay. Are there specific questions that the patient should ask during their initial consultation?
Absolutely. I would, first of all, ask or inquire about whether your surgeon is board certified by the American Board of Plastic Surgery. I would want to know if the facilities that they operate are also fully credentialed, accredited facilities. For the patient themselves, I would ask if I'm a good candidate for the procedure. And I would want to know if the surgeon does the procedures frequently and feels confident with the procedure.
Okay. Typically, how much does breast augmentation cost?
That can range by time being one factor, the choice of implants, and whether any other additional procedures are needed, such as a breast lift. But the general range could run as low as $4,500 during a good discount period, up to well over $6,000.
Okay. If someone wants this procedure and maybe they don't have that kind of money laying around, what financial options are available?
Well, the options, well, you say if they don't have the money laying around, so if they don't have the cash and they don't have the means to write a check, certainly financing is a key way. We have a financing company that we utilize, CareCredit.
Okay.
They have a variety of financing options. One of the most popular is the 12-month no interest.
Okay.
And then for patients that are able to get some money but just slowly pay off, we have a cosmetic account, as we call it, where they can come in and whatever their time frame is and pay the account down over time until it's completely paid off and then ready to move forward.
What type of breast implants are available, and what determines which type is more appropriate per patient?
That's a great question. The two major implant styles are the silicone or silicone gel implants and the saline implants. One major factor is patient choice. For me as a surgeon looking at the patient, somebody that may be very thin-skinned, very thin muscle, trying to reduce the risk of rippling and wrinkling, I'd want to go with a silicone gel implant that would reduce that risk. Maybe somebody wants a lot more volume, a lot more robust upper breast fullness as much as they can maximize. I would go with the saline implant and fill that up to an appropriate volume. There's a tremendous number of other factors. We do have teardrop-shaped implants, so somebody that's looking for the most natural appearance, that would be an optimal choice.
Okay, interesting. What are some of the risks and complications that are associated with breast augmentation?
Well, the number one risk would be something called capsular contraction. That's bad internal scarring around the implant. I have techniques to minimize that. And then number two would be implant failure. As 15, 20 plus years goes by, the implant is going to wear and eventually fail, just like orthopedic hips and knee replacements. In due time, it would need to be replaced. Outside of that, you end up with your typical possible complications that can occur with any surgery, and that would be poor scarring, infection, poor wound healing, excessive bleeding, and would be the most common possibilities.
Okay. You mentioned an amount of time. How long do these typically last, each one?
Now, we're still studying that, so
Okay.
that's one we don't have an answer, but I can tell you that around 10% of each style of implant fails in 10 years' time.
Okay.
Beyond that, we don't have a value at this point saying where 50% of the implants have failed. I would estimate, with my experience and seeing my patients, you're going to be looking between 15 and 20 years with whatever style of implant between the silicone gel or the saline before about 50% would fail.
Okay.
But I've seen implants last well in the 20 to 30 year range too.
Good to know. Is there anything that a patient can do at home to kind of prepare themselves for the surgery?
Well, a good diet, doing as much exercise as you can for your own needs, and getting yourself mentally and physically prepared for the surgery as much as possible. Being prepared for after the surgery, as far as having family members there or
Right.
friends to help with you, and having your food and all your belongings and possessions all prepared and ready for after the surgery.
Okay. So tell us how the procedure is performed, starting with the anesthesia.
Sure. Breast augmentation, I prefer to do it under general anesthesia.
Okay.
So the patient's completely put to sleep in a credentialed surgery center. And after everything is sterilely washed and prepared, you have three options of incisions. The most popular is an inframammary incision, which is on the under breast fold. Second would be a periareolar incision, which is on the outer edge of the areola. And the last would be an armpit incision, an axillary incision. Once we would have chose that in advance, the incision's made, then I have a choice about whether I go under the muscle, which would be the pectoralis major muscle, or whether we go on top. Going under the muscle is the preferred technique, certainly this century, because of the risk of reducing capsular contractures and hiding the implant better. So generally we go under the muscle nowadays, and then choosing which style of implant, whether it be the saline or silicone, placing the implant under the muscle, which is under the breast, and sitting the patient up, evaluating the patient to determine good symmetry, good placement of the implants. And once that's all completely taken care of, then closing the incisions, which is done in multiple layers. There's a deep closure, and then there's multi-layer skin closures. All the incisions and suture is all buried under the skin, so there's no exposed suture, and the stitch all dissolves.
Okay. So every surgery has risks, right? But with breast augmentation, what is the percentage of that?
The percentage would vary depending on which study you would read. I would look at myself and what my percentage would be. And with a straightforward breast augmentation, it's going to be less than 5% for a complication.
Okay. What is the difference between a breast augmentation versus a breast lift?
Breast augmentation, it would involve enlarging the breast, utilizing typically a breast implant. And a breast lift is actually rearranging the breast tissue, elevating the nipple and areola, removing excess lower hanging breast tissue.
Okay.
So it's redesigning the breast into a more youthful appearance. They can be combined, obviously, with enhancing the breast and lifting the breast, which is a very common procedure that I do.
So what percentage of the time people come in for breast augmentation and end up getting maybe both breast augmentation and breast lift?
Well, that would range in anywhere from about 25 to 40%.
Wow.
Yeah, and some of these patients obviously know in advance that they require a breast lift, and they'll come
Right.
in and mention this. Some are unaware, and they think that just the augmentation would treat the breast and make everything look normal again, and I have to inform them, hey, you're going to require a breast lift, and we go over the options, and they're all for it, and we get them taken care of.
What can the patient then expect during recovery?
Well, after the surgery, the pain and muscle spasms are controlled with pain medication and muscle relaxers, so patients tend to do very well with this. You're going to have initially a very tight chest as that muscle and the breast skin is getting adjusted to the implant, and as the days and weeks go by, that relaxes. The typical bruising and some swelling afterwards. And then generally it takes about a week, 5 to 7 days to get the patient back to work, to get them back to exercise, where it's unrestricted exercise would be 6 weeks.
Okay, 6 weeks. What can a patient do if they're just not happy with the results?
Well, number one, you got to talk with your plastic surgeon, discuss what you're unhappy about, and the plastic surgeon, number one, they want the patient happy. So whatever that can take. And then at that point, once we determine what they're dissatisfied about, to see what we can do to work with it. I always recommend, and I'm sure my colleagues would recommend, waiting a minimum of 6 months to let everything settle in, see the final results, and then make determinations if there's something that could be changed, such as a larger implant, or whether the patient would require a breast lift in addition.
Gotcha. Okay, so what can the patient expect to experience in recovery, but as time goes on?
Well, in the recovery process, I would say that you're not going to be driving, you're not going to be going out and doing activities outside the house much for the first couple days. After that, it would be fine for somebody else to drive you around, to go out and do some easy walking at the local mall or something of that nature. By a week's time, generally patients are back driving and back to work actually at that time.
Wow. And do they tend to settle more as time goes on, or is it pretty
Absolutely.
quick? Okay.
Yeah, it's variable, but most patients, initially the implants are firm and high because of the amount of tension on the chest.
Right.
And as a week or so goes by, the tissue begins to relax and the implant settles in a better position and the result starts looking better.
Thank you so much for your time. We really appreciate it.
Sure, thank you.
Absolutely. We learned a lot about breast augmentation from one of the country's leading board-certified plastic surgeons. If you're considering breast augmentation surgery, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Frina with CareCredit, and I will see you soon.
Through October 31st, 2022, earn an entry for your chance to win $2,000 in the Let's Get Digital Sweepstakes. Enter the secret word implant in the Sweepstakes Hub to earn one entry now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States and U.S. territories, including D.C., 18 years of age or older, who have a CareCredit credit card as of 9/6/2022. Void where prohibited. Promotion starts 9/7/2022 and ends 10/31/2022. Sweepstakes prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.